Hi, welcome today. My name is Dr. Alessandra Geischer, and we're meeting today with Dr. Karen Diefenbach to talk about sacral nerve stimulators. How are you doing today, Karen?
I'm great, how are you?
Great, well thank you for meeting with us today.
Sure.
Can you tell me a little bit about sacral nerve stimulators?
Yeah, so a sacral nerve stimulator, or an SNS, is an electronic device that can help with pelvic floor function for both urologic and colorectal problems. It's an implanted device, and it's something that can help as an adjunct to your medical therapy when your medical therapy really doesn't get the entire desired effect.
Who might be eligible for this type of a device?
So patients that are having chronic kind of colorectal or urologic problems that the medical management has really just not been successful in reaching their goals, either for incontinence or soiling, for some patients with functional disorders or constipation, it may be beneficial for those patients. It won't be possible for me to tell right off the bat until we have a full evaluation of what's been done and what their current medical management is. But once we have a chance to evaluate a patient, we can kind of make our recommendations and whether SNS would be appropriate.
So it sounds like sacral nerve stimulator, or SNS, is not the first line therapy, that we always try other things first.
That's true, and even after the procedure itself, it will be used in conjunction with a medical regimen. So it's rarely something that is the only thing that's needed.
So what does the surgical operation look like for this? Is it a single stage operation?
It's actually a two-stage operation. So we're able to do a trial of the device before we actually make the decision for the final placement by doing a stage 1 with a temporary trial. And that's about a 2-week trial period where we see if the device gets the desired effect for the patient. And then if it does, we proceed on with the second stage, which is placement of the permanent generator.
I know that every surgical procedure has some kind of risk. What are the particular risks of this procedure?
Yeah, so there are obviously risks associated with the device itself, but in general, the surgical risks are fairly small. Bleeding and infection are the main risks with any operation, and infection specifically. With an implanted device, we want to be extra cautious that we try and minimize that risk. And so we take a lot of specific precautions during the procedure for placement of both the temporary lead as well as the permanent generator to try and minimize that risk.
And it's a device that has a battery within it. How long does that battery last, and what happens when it runs out?
So there's been a lot of advancements in the procedure and the device itself. For one, the battery is able to last a lot longer. There's actually 2 different options for patients. And it's really based on what the patient is most comfortable with. So we have one option, it's called a non-rechargeable battery. So if you're the kind of person that forgets to charge their cell phone, you might want to consider this option, and it will last from 7 to 10 years, depending on how high the settings are and how often it's being used. And that would require a surgery to replace the battery when the battery is no longer functional. There's also a rechargeable device, which is actually smaller because it doesn't have to hold all that charge for several years. And if you're the kind of person that always remembers to charge their phone, then maybe this is something that's good for you. And because it can also be placed in very small, thin patients, it's somewhat more comfortable for them.
So after the sacral nerve stimulator is placed, what does recovery look like? Do the patients stay inpatient in the hospital after surgery?
No, these are outpatient procedures. Actually, both stages are outpatient. And for the most part, patients do very well after this procedure. There's really, from the standpoint of recovering from the anesthetic and the incisional pain, it's really just a couple of days. We do, however, put some restrictions on the patients because we really want to protect that area where the device is implanted from any trauma to minimize risk of bleeding or anything like that. And so we restrict them from kind of contact sports and activities in which they can fall for about a month after the procedure. And then after that, I usually recommend to the families, and they're pretty creative on how they do this, to pad the site. So things like bicycle shorts with shoulder pads sewn in, or even snowboarding pants, all of those have been used to pad the areas. But we just really want to protect the site from any trauma.
So after that month period, the child or the patient could potentially do any activity or most activities?
I typically don't put much in the way of restrictions on them unless we have an activity that has been shown in that particular patient to be problematic. So for example, if you're a hockey player and you can stay on your skates, you can play hockey. But if you keep falling down on your bottom and you keep traumatizing the site, maybe not. What I do recommend to the families, and they're really creative about this, is that they pad and protect the area. Again, just to avoid potential injury to the site. I don't put many restrictions on them.
That sounds really great. I feel like I've learned so much today about sacral nerve stimulators. I hope you all out there today have learned something as well. If you have more questions, feel free to go to our website, nationwidechildrens.org at CCPR. Thank you. Thanks so much, Dr. Diefenbach.
You're welcome. Thank you.